to reducing the harm caused by smoking in this country? Thank you, Mr. Speaker.
Andrew Williams. Thank you, Mr. Speaker. I take a call on behalf of New Zealand First and the Customs and Excise Tobacco Products Budget Measures Amendment Bill. This bill, which will see a 10% cumulative increases in tax on tobacco commencing 1st of January 2013 and every 1st of January thereafter for 4 years, taking a packet of cigarettes from something like $14 a packet to around $20 a packet by 2016. The bill, Mr. Speaker, states that the increase in the price of cigarettes will discourage tobacco consumption, which in turn will improve the health of New Zealanders. New Zealand First will not oppose this bill, as we agreed that it is in New Zealand's interest to tackle the harmful effects of smoking, and the costs of cigarettes is one tool, a very simple, basic tool to limit consumption. However, Mr. Speaker, New Zealand First does have some concerns that this may be just a payoff by the National Government to the Maori Party in order to keep their vote and support. Is this just a sop to one of their Klingon parties to maintain their vote? Bit like the charter schools, another sop to a Klingon party to keep their vote as well. So, Mr. Speaker, we do wonder, and having heard in this House today how the National Party had opposed many other increases in excises in the last decade, it is interesting that suddenly the leopard changes its spots and agrees with it, but probably only because the Minister Turia has managed to convince them that she will only maintain her vote with them if they support this particular bill of hers. Mr. Speaker, we do have concerns, however, that this money will not just disappear into the General Consolidated Fund as another way to prop up the National Party government's Fagan budget. We've already had the pick a pocket or two budget this year, where they included taking $14 million of taxes from paper boys and paper girls of this country, getting down to the rock bottom way of getting money into the coffers by attacking the young people of this country who are trying to get out there and make a little bit of pocket money to perhaps pay for some of their things that they would like to have which they can't afford to have. Or in some cases where I've heard young children have actually paid for their annual school camp from the money that they have made from their paper round or their odd jobs. So, Mr. Speaker, it would be disappointing if this tax was taken each year, 10% cumulative each year, a significant amount of tax, but it was only to then disappear into the coffers. New Zealand First is supporting this on the basis that those taxes do go into genuine health support and trying to reduce smoking, such as public awareness campaigns. An increase, for instance, in the media spend, concentrating, for example, on the media showing the real effects of smoking on unborn babies. Real stories, real people, the good and the bad. We would expect, Mr. Speaker, that such campaigns would dispel the whanau myths that smoking is a killer, but the messages that may come down through the Māori whakapapa contradict these, such as "I smoked through all my pregnancies and you lot are all right." The truth is, Mr. Speaker, cigarettes now contain many more poisons than ever before. They are more potent, and New Zealand has more poisons than ever before. They are the highest levels of nicotine in the world, which therefore makes them more highly addictive and harder to do without. New Zealand First would expect more funding from these tax increases to allow health professionals to work with specialist populations, such as more specific support for those with mental illness who may find it difficult to quit without that extra assistance. Mr. Speaker, the primary health organisations through New Zealand are doing a tremendous job in helping public awareness of this problem and this addiction. Smoking cessation programs need to become more integrated and prioritised across contracted funding streams such as cardiovascular disease and diabetes. Quitting smoking reduces risk across these health issues as well, so the flow-on effect to our health system is enormous. So, Mr. Speaker, it can't be just an isolation of taxes on smoking, but it must be hand in hand with the other health measures as well. Cigarette taxation needs to fund research with resources made available to those who are at the coalface without there being huge application processes. Access to researchers who can give their time to help write up case-based realities to share and grow existing smoking cessation services. We need more training and recognition of the smoking cessation workforce and access for funded quality training. We also need money from these increased taxes to go into an innovation fund to recognise that there are lots of great suggestions to try to quit smoking, such as around the world where they've tried quit cafes, and those quit cafes have been successful in many other countries. Mr Speaker, I also sat on the Finance Committee on behalf of the Right Honourable Winston Peters on his behalf, and one of the discussions that came up during that committee was that this didn't cover duty-free cigarettes, and that in fact there is a significant consumption of cigarettes that come via the duty-free stores in our airports and our ports, but there was no real data. The officials could not provide data on how many duty-free cigarettes were being sold. In Australia, they have reduced duty-free, the dispensation on duty-free cigarettes to only 50 now, whereas we still are at 200. And therefore, if the Australians can see fit to reduce it to 50 cigarettes, then, Mr Speaker, we should be considering likewise. Otherwise, why do all this work, why do all this effort to try and increase the programs, to try and improve the education around smoking and ceasing smoking, and yet still allow pallet loads, literally pallet loads of duty-free cigarettes to hit you in the face as you walk off the aeroplane? Mr Speaker, if we're going to be genuine about reducing smoking and reducing the use of tobacco and cigarettes, then this government certainly needs to also look at duty-free cigarettes and line ourselves up more with the Australians who have obviously decided to get on top of the problem. Mr Speaker, New Zealand First will be monitoring what funding is provided from this taxation, and to ensure that the programs that I have suggested and the health measures that I've suggested will receive the benefits of this increased taxation. We will expect to see funding and delivering of smoking cessation programs to go up quite a few notches from where it is at the moment. Not just lip service from the national government, but proper funding and delivering of programs to help the health of New Zealanders. These cigarette tax increases must not just be another way for this penny-pinching Fagan government to pick the pockets of good everyday New Zealanders in order to balance the books of an ever-failing government.
Mr Speaker.
John Hayes.
Thank you for the opportunity to speak on this debate.